behind a locked door in the University of Maryland School of Pharmacy, we find a selection of pharmaceutical ingredients. Over here we have some active ingredients. There's some ibuprofen on that shelf and metoprolol and some sulfamethazine up there. But most of what goes into pharmaceutical formulation is what's in the rest of the room, and those are excipients. So those are the things in tablet formulation that help the machinery work and help the tablet hold together. As the world availability of chemicals changes, it may be that excipient access is restricted. So some of these come from New Jersey, but most of them come from farther away. The availability of the binders and the lubricants that make manufacturing work might change. And in those supply chain disruptions and facing those challenges, it may be that 3D printing is the way to cope with those alterations and even emergencies. That is, if you can formulate differently with fewer excipients, for patient use, there can be higher drug loading. That means they get more of the active ingredient in the drug, which can be an important change. But also it can be that you simplify the process, fewer excipients, and therefore a simpler process. And that means if you haven't got everything you need and you worry about what to do, it's time to think about 3D printing as a potential short-term and maybe longer-term solution for access to medicines.